applause goes to all of you.
Yeah, that is true. Thank you very much. Good afternoon to everyone, and as always, thanks to those who are tuning in. I know that people are practicing social distancing, so there were lots of folks who couldn't come today, including all the reporters, not to mention everybody at home who tunes in every day. For today's 2:30 update, we're coming to you live from McCormick Place in Chicago, where the Illinois National Guard, the Army Corps of Engineers, and a host of tradespeople are setting up the largest of our alternate care facilities to support our response to COVID-19. I'm here with the City of Chicago's Mayor, Lori Lightfoot, with Deputy Chief of Engineers and Deputy Commanding General of the U.S. Army Corps of Engineers, Major General Robert F. Whittle, and Dr. Nick Terkel, former President and CEO of Advocate Aurora Health, and now the Executive Director of the McCormick Place Alternate Care Site. Folks, I want to share with you just how important this day is for Chicago and for the state of Illinois. 5 short days ago, this was an empty convention hall. There was truly nothing here. Throughout this week, I have tracked the progress of this build-out, and I want you to know that I'm genuinely blown away by what's happened here. We've all been through a range of emotions together these past several weeks as we've battled COVID-19, but when I walked into this building and saw how it was transformed in just 5 days, I was truly flooded with an overwhelming sense of pride and patriotism. The teams on the ground here have brought everything to the table for Illinois. In less than a week's time, they've assembled 500 rooms and beds, 14 nursing stations, and full support rooms for supply storage, pharmacy needs, and housekeeping. In 1 week's time, the heroes who came together to make this possible built us a facility larger than the largest hospital in Illinois. 1 week, and they will be building out to 3,000 beds before the end of the month. This, folks, this is Illinois. I'm not sure I can fully express the extent of my gratitude to the many individuals who made this happen. I want to thank the Army Corps of Engineers, the Illinois National Guard, FEMA, and the hardworking union tradespeople. And I'm going to list all of them because they all deserve recognition. Electricians and plumbers, carpenters and pipe fitters, teamsters, telecommunications, laborers, operating engineers, decorators, sheet metal workers, iron workers, and finishers. Monumental, round-the-clock dedication is what got this done before we need it, preparing for saving lives in the event that things become as bad as some have predicted. Really, to all of you who are tuning in today from across the state, you should be so very, very proud of what's happened here, and they're continuing their work. We've also launched work on 3 other sites in Chicago and the Collar counties: the former Advocate Sherman Hospital campus in Elgin, the Metro South Health Center in Blue Island, and Westlake Hospital in Cook County's Melrose Park. And today, I am proud to share with you our next site, Vibra Hospital in Springfield, Illinois, which will begin to add more beds to our capacity in central Illinois. I want to take a moment to walk you through the why behind these facilities. As incredible as the work that's been done here is, it's also profoundly sobering. This is a facility that we stood up because the human population is susceptible to this virus at a scale never before seen in our lifetimes. And it very well might be that this virus overwhelms our existing hospital capacity in Illinois, as it has done in Italy and other countries around the world, and as it's beginning to do in other parts of our country too. In places like New York and Boston and Detroit and New Orleans, we're already seeing this very real scenario take place. As a point of reference, on March 24th, we here in Illinois had about 26,000 non-ICU beds, 2,600 ICU beds across the state. Every day since, we've added beds and equipment at our existing hospitals to increase capacity. Even with those efforts, of our now nearly 28,000 beds in the state, only 11,500, or 41%, are currently available. That's a lot fewer than is normal for this time of year. Even more striking, of the approximately 2,680 ICU beds in this state, just slightly over 800 are available. That's just 29%. And that availability is diminishing as COVID-19's presence continues to grow. Since yesterday's update, Illinois added 1,209 cases. COVID-19's reach now stretches to 64 of our 102 counties. In the last 24 hours, 53 Illinoisans lost their lives fighting COVID-19, bringing the total number of Illinoisans who have passed away because of this virus to 210. That's 210 fathers and mothers, brothers and sisters, grandparents and children who are no longer with us. May their memories be for a blessing. They are the impetus for us as we prepare this facility at McCormick and the other alternate care facilities around the state, because I never want to get to a place where our families or our friends don't have a place to heal, or where our hospitals don't have the capacity to give them the best chance possible to beat COVID-19. Preparing also means proactively assembling the healthcare workers who will bring these facilities to life. A hospital bed is just a bed until it has the staff and equipment to turn it into a place to treat COVID-19. We've already assembled the medical personnel who will staff these first 500 beds. Nearly 140 healthcare heroes from around Illinois and the nation are ready to work here, and we'll be adding many hundreds more as the need evolves. Before I turn it over to Mayor Lightfoot, I want to address one final topic. Over the last few days, we've seen information start to trickle out from the White House and the CDC about whether or not the general public should be wearing masks. So let me go ahead and tell you where I see the science trending. Epidemiologists and infectious disease experts are still studying how COVID-19 travels through the air between people, and particularly how it travels from people who are asymptomatic or pre-symptomatic. That research is still evolving, and it'll continue to evolve. Nevertheless, here's what I think, and it's based on what the experts seem to be saying. There's a reason that we're raised to cover your mouth or use your elbow when you cough or sneeze. It's a simple gesture to reduce the number of germs that you spread to those around you. The doctors all agree that this virus can be spread through droplets, like when you sneeze or cough. So blocking that by wearing a mask in public seems like a common sense way to do what's right for everyone around you. The most important thing you can do, frankly, is stay home. But when you do go outside, or when you must go to the grocery store or pharmacy, wearing something to cover your face is a good idea, based upon what the science says. Maybe it's a homemade fabric mask, or maybe it's a manufactured general medical mask, really just something to cover your nose and mouth out of courtesy to those around you in case you're one of those who are asymptomatic or pre-symptomatic and who could be spreading the virus. Wearing a mask is just one more way that we can help take care of one another in our state. So thank you, and now I'm pleased to turn it over to someone who's been such a terrific partner, not just in building out this facility and manning it, but also in all things that we've worked on with regard to COVID-19 in the city of Chicago, Mayor Lori Lightfoot.
Thank you, Governor. You know, we started out this moment here together with many of the workers who have done unbelievably phenomenal work clapping. But as I said, the applause is for all of you. This is a phenomenal amount of work. We started on Tuesday with an empty box, and now look. So good afternoon, everyone. I want to acknowledge the incredible leaders who are standing with me. Of course, our great governor, who has led in a time of real uncertainty with boldness and conviction, and I think has given all of us a sense of confidence that we have the right leader in place for the state of Illinois. Thank you, Governor. I want to acknowledge Major General Robert Whittle of the U.S. Army Corps of Engineers, and for also our great Colonel who's here in this district. I also have to call out our public health leaders who are here. The Director of the Illinois Department of Public Health, you see her every day standing side by side with the Governor, Dr. Ngozi Ezike. Thank you, Doctor. And Chicago's amazing, I'll say amazing, Public Health Commissioner, Dr. Allison Arity, who I have on speed dial and gives me great comfort that we've got the right team in place in public health in the city. I also want to give a special thanks to Dr. Nick Terkel, who, as the Governor said, is now the Executive Director of the McCormick Place alternate care site. Thank you for stepping up. Thank you for coming out of retirement and really taking on this incredible task. I want to also acknowledge Paul Merrick, the CEO of DuPage Medical. Folks, we would have no staffing here without DuPage Medical and the men and women from that executive team who have stepped up to provide the real services that are going to be necessary when this site is operational. So thank you, one and all, to DuPage Medical and Martin Judd, the former CEO of St. Elizabeth's, who will lead a team of accomplished former administrators working intensively to stand up and staff this new site. I have to thank Larita Clark, the head of McCormick Place. She's been on the job, I think, about 2 months maybe, and also, like all of us, is being tested in this time, and she stood tall. I want to say thank you to her and the entire MPEA team. And last but not least, I want to call out actually two more folks. The Governor ran through the list of incredible tradesmen who took this empty box and turned it into what you see now. For all of you, one and all, led by Walsh Construction, thank you, thank you, thank you. I also have to say thank you to Mayor's Office team who have been here on site literally every day. I think some of them are actually sleeping here and are going to continue to make sure that we get the job done. I got to thank the Army Corps of Engineers. They're with us 110%. They had descended on Chicago only a mere week ago and got to work to construct this unique clinical setting so that Chicago can be prepared for whatever the next phase of the virus takes us. And of course also the team from the Illinois National Guard who have been on site continue to do the hard work. Well, when this new year began just 12 short weeks ago, none of us expected to be here touring McCormick Place as an alternate care facility, but here we stand. And as you can see, the team has just completed phase 1 of this build-out, which currently provides 500 hospital beds for low acuity COVID-19 patients. By the time the work is finished, we'll have 3,000, all of which will provide wraparound services for these patients, of course, medical care, but also all the other amenities that are necessary for a care facility of this type: food service, pharmacy, and so much more, all of which will alleviate the burden on our local hospitals, allowing them to focus on patients most in need and to save as many lives as possible. The timing of this facility is no accident. Since this crisis reached our city's doorsteps, we have been working day and night in partnership with the governor, the state, and the county to take proactive measures to ensure we stay ahead of the capacity that might be needed in the event of a surge of this violence, with a system of care built to keep our residents safe and protected. And let me share a glimpse of why this alternative care facility is so unique. Again, this is the product of all of us working together. The size, the speeds, and the scope is like anything else in the country. Construction has been going on 24/7. And they put up this first phase in a matter of days, which is probably unheard of. It's the first COVID positive facility in the country. And we'll have several areas to be able to segregate patients one from another. As I mentioned, it's a low acuity center intended to take the strain off the existing hospital system. The largest planned alternative care facility in the country. And we are fortunate to have the healthcare experts running this facility who you'll hear from in a moment. I have to give some praise to the entire hospital ecosystem, not only just in Chicago, but the surrounding area and the region, who have stepped up in truly remarkable ways. And now, when I call them out, it doesn't mean if you're not mentioned that you haven't helped, but some really have gone over and above. Rush Hospital. Not only have they contributed their expertise, but they've already converted part of their hospital to a negative pressure facility to be able to care for those who are most in need, and have contributed the electronic medical system that will be used here on site. I've mentioned DuPage Medical and the incredible work that they are doing to staff up this facility. Mercy Hospital, which is nearby, stepped up right away and said, how can we be helpful? So thank you, and also thank you to the Illinois Hospital Association for what they have done every single day to be a partner with us in this fight. It's in that same spirit that I am proud to announce that starting Wednesday, we will be making 200 rooms in London House and 225 rooms in the Godfrey Hotel open for healthcare workers. As with the rooms in the hotel exits that we created for our first responders, these rooms aren't for healthcare workers who are themselves sick, but instead those who are coming into contact with COVID-19 patients on a daily basis, working incredibly long hours, and prefer a safe place to stay rather than going home and potentially exposing their family and community to this terrible disease. I want to express my fullest thanks once again to the Oxford Group for their incredible partnership in making these sites available, and for exemplary civic leadership during this crisis. Each of these measures I just listed build upon the many that we've already taken to address the full impact of COVID-19. In addition to caring for those who are sick, we are also working tirelessly to support the thousands of Chicagoans who have been beset by the economic impact of this crisis and who are struggling on a daily basis with basic issues like food, rent, bills, and countless other essential expenses. We have to be in this together, and we will get through this by working together as we have, and there's no greater example of that simple fact than what you're witnessing here today. Here in Chicago, we are still actively seeking to fill volunteer and employment opportunities for residents interested in stepping up. This is especially true for those with medical expertise, and that includes doctors, nurses, assistants, and really everyone that's part of the healthcare ecosystem. You can go to our website, chicago.gov/coronavirus, and look for opportunities to step up and to contribute in this time of need. I want to also just say here in closing that this has been a remarkable experience for all of us. No one expected that we were going to be in this fight for our lives literally every single day. And like the governor has mentioned many times, people stepping up across Illinois, people here in Chicago are doing the same thing. And I just want to say from the bottom of my heart and on behalf of a grateful city, we thank you, we need you, and we will continue to forge forward together. I want to again take this opportunity to thank Governor Pritzker once again for his bold and steadfast leadership through this crisis, and for making all of these issues a priority in a statewide fight. And for that, I am, and the city is so grateful for your leadership, Governor. Now with that, I'll turn things over to Major General Robert Whittle to provide some remarks. Major General.
Thank you, Mayor. Good afternoon.
Good afternoon.
It's during a crisis like this that character comes out, and I would like to thank Governor Pritzker and Mayor Lightfoot for their steadfast leadership during this crisis. This is when you find out what people are all about, and I can tell you that right here in Chicago and Illinois, we are getting it right. I'm in the Army, and so I'm going to speak to this in some Army terms. And so there's an enemy out there, and that enemy is the virus. And when this virus attacked, my boss, General Todd Sebenite, took a look at the situation. And we know that across America at any given time, about 2/3 of all hospital beds are full. And about 2/3 of all ICU beds are full. And so if a virus is coming, and it's going to come and it's going to multiply exponentially, then it can be expected that the remaining third of hospital beds that are typically empty, or the remaining 1/3 of ICU beds that are typically empty, may be filled. And so he knew we had to come up with a plan very rapidly to have a solution for extra beds. He charged his team to come up with a standard design. And what we've done is we've shared that design with governors and mayors across the country, and we've offered the help of the Corps of Engineers, your U.S. Army Corps of Engineers, to help wherever needed. We've also shared that design in case state and local authorities want to do some of that work on their own. All this is under the auspices of FEMA. And I would like to recognize the Region 5 Director of FEMA, Mr. James Joseph, who's here with us today. His partnership is absolutely critical in making these things happen. We have 8 awarded contracts now across the United States. 3 of them are here in Illinois, and this is a testament, again, to the leadership here. None of this is done without great people, and I'd like to also take a moment and recognize those. Alicia Tate Nadeau from the Illinois Emergency Management Agency, General Rich Neely, the Adjutant General for Illinois and the Director of the Illinois National Guard, Dr. Allison Arwani and Chris Shields from the Chicago Department of Public Health, our partners at the Metropolitan Pier and Exposition Authority, and Walsh Construction. These great contractors, these great tradesmen that stand behind us, they are the power of your U.S. Army Corps of Engineers. They're the ones who actually build things. They are getting this done. Rest assured, together, as a nation, with partnerships like this, we are going to win this war against that enemy. Thank you.
Good afternoon. I'm Dr. Nick Terkel, and I'm pleased to be with you, though I wish we didn't have to be here at all. I want to say thank you to the governor, the mayor, and to Major General Whittle. The amazing forethought and planning that has gone into this has put Illinois and the city of Chicago ahead of where so much of the nation is. We have really great leadership that has been bold and willing to take this on. We should acknowledge that that is going to save lives and allow us to have a different outcome than some other parts of the country. And what we want is the best outcome for everybody in our state and in our city. This is an enormously difficult time for Chicago, for Illinois, and for the entire world. And I think it's a time for everyone to step up, and as you've heard today, they are. It's a time for everyone to come together and work in the same direction, but not come together too closely, 6 feet apart. It's been unfortunate I haven't been able to shake the hand of any person that has volunteered to help this week. But that's part of solving this crisis. And it's a time to be prepared, and that's what we're doing here at McCormick Place. So we all fervently hope that we will never need to take care of a patient here. And that would be wonderful, but I think it's very unlikely. We expect to see patients here, and we are going to be prepared to do so. So let me tell you a little bit about what we'll be able to do at this site. And it is an alternate care facility, not a hospital. That's important because its purpose is to take care of COVID-positive patients first of its kind in the country, that are less severely ill, so mild to moderate illness. That's the people we'll take care of here. We're working in partnership with our hospitals, and I have to tell you all, you probably know it, but we have the best hospitals and healthcare in the world right here, right around us. Working with them, we are timing how quickly we accept patients, and we're going to be very flexible in understanding that we have to roll with the punches, if you will, and be able to alter our model if need be. So I want to make one other thing clear, because I know people around the city of Chicago will wonder about this place. So I've said it's not a hospital, it's an alternate care facility, but it's important to know how people will get here. This will never be a place that has an emergency room. It will never be a place that people come to the front door and admit themselves. This is a place that will relieve some of the strain from our hospital partners. We will accept patients from our hospital partners who are already COVID positive and who are appropriate for this kind of setting. I think it's really important for the public to know that, so there won't be any confusion about who should come here or how to get here. Your healthcare providers, your doctors, your hospitals, they will direct you to this site if it's appropriate. We've assembled a really strong team here, and we are ready to respond. Let me just express my thanks to every single person that I have met in the last 48 hours who has stepped up and offered to help. The Army Corps has done just amazing work here. It's unbelievable to see what's happened to this space in just a matter of a few days. Rush Medical Center, we talked about, they're helping in so many ways. DuPage Medical Group, the Illinois Hospital Association, and all the other hospitals are in communication with us all the time and saying, how can we help? How can we make this work for the people of Chicago? The other thing I would say is that every single person working here is here because they understand how important this is. They're proud of their work and they're ready to serve. So my thanks again to our city and state leadership, and I just want you all to know that we stand ready to help. Thank you.
Thank you, Doctor. Mayor and I'd be happy to take any questions from members of the media.
Thank you. First of all, Dr. Terkel, could he identify, I apologize, I don't know who he is.
Sorry.
His title.
He's executive director of this alternate care facility at McCormick Place, but he was the CEO of Aurora Health.
Thank you. And he might have, some of these questions might be best to him. Folks are asking, where did you get the medical personnel? Who are they? Did you take them from other hospitals? How did you find them? And do they have enough PPE?
So let me take those in order, if I can remember them all in order. First of all, we are assembling a team that will be able to flex and grow in size as we need it. We're prepared now to staff these first 500 beds, but as you know, there's a plan to build out additional space here at McCormick. So the priority right now is training the people that will work in the space behind us. Those people are coming from a number of sources. The state has been very helpful at AIMA with helping us to provide, to have some nurses and other providers come in. DuPage Medical is volunteering and bringing a number of their staff to help with both leadership and then also to work here as doctors, nurses, and other healthcare providers. We're in discussions now with additional people who may be able to help us, and that may include local university medical centers. It may include people from out of state at times, but our focus will be on staff this with local knowledge and expertise, but don't disrupt the local hospital ecosystem. We want the hospitals to be able to keep all their employees with them doing the work that they need to do there, so that we really become overflow or release of the strain on those hospitals. PPE, I believe, was your last question, and that, I think, is an ongoing concern for our entire nation. There are discussions at the federal level about how that will be distributed in coming weeks, and I think we have to say more to come on that. We will keep up with it and do the very best that we can.
Can I ask you also, what we understand is that folks have been hired to work 21 days on, 2 days off. That's 12-hour shifts for nurses. Some are critical of that and worry that there will be a high burnout rate if you work that much. And also, is the pay actually $125 an hour?
So again, several questions there. Let me try to address all of them. First of all, the staffing model is still in development. We are planning on 12-hour shifts, and part of the reason for that is to reduce the use of PPE. If we have 3 shifts a day, we have more people coming in and out, burn up more of the materials that are so critically important right now. So we believe 12-hour shifts are the best, and if you look around healthcare today, 12-hour shifts are the norm in many places. I'm not very concerned about burnout. As far as days on and off, we will flex that according to the needs of the staff, and that is not finalized yet. The pay I'm not going to address today. I think there have been many rumors and misconceptions about what the pay is, and I'll tell you we're working through all those details. But I said earlier we're going to be flexible here. We're going to be flexible in every way in who works here, the number that work here, and how we do shifts and things. We have to be able to roll with the punches.
21 days on, that is what some signed up for.
That's news to me. So I have not seen that information, and I don't believe that we're going to expect anyone to do that.
Okay, thank you.
You bet.
Governor, there's another question here. How many people should Illinois be testing a day, and how long is it going to take to get to that point? Is the state struggling to test its population at a sufficient level?
Well, I have been saying, I think every single day that I've had a press conference, and maybe days before that, that we do not have enough tests. The federal government said they were going to provide millions of tests, and all the states relied upon that promise, and it still hasn't happened. So we've taken it upon ourselves to grow our testing capability. As you know, in our first days, we used our state labs in one shift, which is all we ever had at our state labs to begin with. We had 3 labs, 200 a day at each lab. That was all we could do at the very beginning. Today, now, we're doing around 5,000 on average per day, and we're trying to get to 10,000 per day. Frankly, I'd like to be at 100,000 per day if we could, but right now, the testing supplies, the swabs, everything about the tests are very difficult to come by, and there's no federal plan for this. So every state is on their own. As I've said, it's the Wild West out here. But my plan and our plan, working with our experts and scientists, epidemiologists, is if we can get to 10,000 per day, that helps us both test the people that will, come forward with symptoms on any given day, and give us meaningful data, which is hugely important so we know where the outbreaks are taking place, and when we need to, on an emergency basis, test, for example, at a nursing home or in some congregate facility, we can test everybody all at once, 200 or 300 people at a time. So it's extraordinarily important that we build up that testing capability. As I talked about yesterday, we've bought machines, we've bought tests, we've reached out to every company. I've been on with CEOs of all of the companies that do it, Roche and Abbott and so on, and we're doing everything we can to build up our testing capability because we're getting no help from anywhere else.
And to both you and the mayor, Senator Durbin and Duckworth announced that Illinois will get $147 million as it's part of the CARES Act. How will this money be prioritized?
When you say $147 million, you mean because we're
part of the CARES Act, apparently?
Yeah. So, well, the CARES Act should be much more than that. We expect, I think the numbers were published, that between the city and the state and cities across the state, there'll be almost $5 billion that will come to cities and the state of Illinois collectively. But maybe they're talking about what goes to hospitals, which is about $150 billion to hospitals overall, and 147 you're saying for hospitals in Illinois. I haven't broken it down by how much is going to the hospitals in Illinois, I must admit. But we need much more, frankly, for our healthcare system in Illinois, and every state does too, because the expenditures that are being made are extraordinary, because every hospital expects to be overrun. And so they're using facilities and equipment and supplies and hiring people like they've never done before. So the federal government's got to step up and help us.
Could Dr. Arwady or Dr. Ezike answer this one? What is the responsibility of residential building managers to communicate to their tenants when there are positive COVID cases in their buildings?
Yeah. So we know that the local health departments are at the forefront, and they're trying to help with, case contacts, and often the most relevant and appropriate information will come from county health departments, who might be indicating if someone may be exposed. As the numbers grow, the process may change, and so we know that there's a high rate of susceptibility amongst the community. In terms of the specific building managers, if someone is aware, they may post a notice in their building, but there's not a formalized process for that at this time.
Should there be?
Yeah. I'll add, because we're one of those local health departments. And so there remain really strict privacy laws in place around patients who are diagnosed with COVID-19. And so the health department, where we'll have communication with patients, with individuals, but there is not an automatic notification to, for example, a building owner or to anyone else who may be wanting to know about an individual situation. Where there is need, where there has been exposure or there's a particular concern, there are situations where we might, for example, if somebody lives in one of these congregate settings, right? If they live in a nursing home type setting or in a group home type setting, that would be a situation where you would have significant concern for the other residents, and then there would be notification in a way that did not identify the specific resident. We have a lot of protocols around that. But if someone is living in a multi-unit apartment building, for example, and they're able to return, to their home and be isolated at home, there is not a need to notify across that whole building, as long as we believe that the individual is able to be isolated at home just as they would. So we've put information on the website, at least for Chicago, chicago.gov/coronavirus, with a lot of information specifically about multi-unit buildings, about what apartment or building managers need to be doing, about cleaning, about privacy, about all of those things. But we do always play this role between the individual privacy and protecting the public's health.
Other questions I've received, news reports suggest that minorities are getting sick and dying at a higher rate than white patients. When will you start releasing hospitalization numbers, and do you intend to break that number down by race?
Well, look, we are still analyzing the data, and we will release it as soon as we believe that it's appropriate. But we also will be doing that in a way that provides not just the data, but specific action items that the city will be taking, as well as what individuals can continue to do and additional tools at their disposal. But that'll be coming soon.
Thank you. Before I hand it over to Tina, what about, Governor, what Jared Kushner had to say from the White House, that some states don't know what they have in their inventory before requesting equipment from the federal government?
Well, let me start with this. I don't know if Jared Kushner knows this, but it's called the United States of America. And the federal government, which has a stockpile, is supposed to be backstopping the states. He apparently does not know that. Now, at the state level, we had stockpiles, and at the city level, we have stockpiles. And, we're using them now. I don't think anybody expected a respiratory pandemic that would deplete all of the respiratory stockpiles that exist, and that the federal government would abdicate its role and have 50 states, 5 territories on top of that, all competing with one another and competing against the federal government to get the PPE that's necessary. So I think Jared Kushner just does not understand this issue. He does not understand what the federal government's role is supposed to be in a national emergency.
And if I can just add, and I think the governor just showed incredible restraint under the circumstances. he's 100% right. We shouldn't have to beg the federal government to step up and assume its responsibility here. When we hear from the head of the CDC that the federal stockpile only has 10,000 ventilators, the question we should ask is, what the heck has the Trump administration been doing over the last 3.5 years? What that tells me, and I think that what that tells public health professionals across the nation, is that the federal government has failed to do the planning that it needs on a daily, weekly, and monthly basis to be prepared. So we're not waiting for the feds. We're doing what is necessary. The governor and his team have been working tirelessly to source the materials that we need to bring to Illinois. But my, oh my, somebody like Jared Kushner casting aspersions on the hard work of governors across this country who have been working tirelessly night and day to be leaders and to care for the residents in their states, that tells you a lot about the character of him. Speak up.
Working, you might need to.
Question for the governor. We talk about projections a lot and how that's being used with the hospital capacity and other things. Can you tell us what models you're looking at? Like, are you looking at the IHME one? What types of projections are you looking at?
So let me start with, we'll look at any model that is well put together. And, you know, the mayor has developed a model for the city. We developed one for the state. We're looking at the regions of the state. We actually have a team that works together now, looking at all their statisticians, mathematicians, physicists, scientists, who are looking at that to make sure that it evolves as we know more information. So, you know, we looked at the University of Washington model. That's one model to look at. We had a University of Illinois, UIUC model as well. There was one that was developed by a consulting firm here in the city of Chicago as well. So collectively, what we're looking at is, and remember what we're trying to determine with these models. What we're trying to determine is, what does the height of this look like? What does the peak look like? And therefore, what resources are necessary for us to have on hand and to treat the people who are going to be hospitalized, those who will need ICU beds, those who will need ventilators. And so collectively, I think the mayor and I both have said in different ways, in different press conferences over the last couple of days, that we believe, based upon the various models that we've looked at and the collective one that's still being worked on, that somewhere between the middle of April and the end of April might be the peak. Now, I want everybody to understand that just because you say you're going to hit a peak does not mean that you're then precipitously going to fall on the other side of that peak to zero. That does not happen. What we need to know about the peak, and the reason we're all looking at it, is because of the resources necessary at the height. Because that's what you need to have on hand. That's how many ventilators you need. And so once we get to that peak, we're all going to be praying that we come off that peak quickly, but we might not. We might be flattened at that peak. That is flattening the curve. And then we want it to fall, of course. But I think people may misunderstand what the use of a model. It isn't going to tell us exactly everything that's going to happen every day. It does help us to know how well we're doing against what our projections were, so that as we move forward, we can move resources around. You heard Governor Cuomo in New York talk about when they come off of their peak, they may be able to send ventilators to other parts of the country. I hope that's true. And certainly if we can do that, if we come off of our peak and we can help some other hot spot across the country, we're going to try to do that too. We want to be helpful to everybody across the country as best we can. But our first and foremost duty is to protect the people of the city of Chicago and the state of Illinois, and we're going to do that.
I have a couple of print questions about this actual facility. You mentioned the veteran administrators that will be running this. Is there a medical director, or who is running this facility?
So we've assembled our leadership team this week. I'm functioning as executive director, and I happen to be a physician, which I hope is an advantage. But the real important work that's done here is done by the clinical team. So we have a variety of people from physician and nursing roles who are filling key roles in leadership to determine admission criteria, credentialing of providers, how we're going to approach various aspects of the care in this part of the facility. So we're really looking now to clinical leadership and then working with the city and the state for all the wraparound functions at this site. But yes, we have actually a host of medical directors who are helping us with different parts of this plan.
How many staff members will this facility need, and also how many have already been secured? I know you said roughly. If there's a rough range, we're just trying to understand the numbers.
Sure. We're modeling in a different way on that. So we are focused very heavily right now on this first 500 beds. And we have a nice model to understand what it's going to take. We have secured, at this point, a couple hundred people for this 500-bed facility. Remember that it's unlikely that we will open all 500 beds at once. We will scale up as the hospitals get busier. So I'm very confident that we can scale up the staff as we need to.
And then you talked about how patients might get here. Can you run through that process of how
Sure.
a patient might be deferred to this facility?
Sure. So if you can imagine our hospitals getting very full with COVID patients, part of the function at the hospital is the intensive care unit, people that need ventilators. Part of it is people who are very sick but not quite in the intensive care unit. We want all those people to stay at the hospital. Beyond that, as we get to peak, we believe there's going to be a large group of people who will perhaps require minimal oxygen, continue to require medical care of various kinds that would be very well suited to an alternate care facility. We anticipate we'll work with the hospitals and their discharge planning function to say, this group of 10 patients could be safely cared for at McCormick Place. And then they'll be transferred. We have a transfer process worked out already. We have an admission process, and then those individuals would stay here until they're stable enough to go to their home or the site that they originally came from.
Are the healthcare workers that will be working here, are they covered for liability?
I might ask the governor to address that. We're very pleased about the executive order. I'll say most healthcare professionals come with liability insurance, but in a crisis like this, we're very appreciative of the state's efforts to say we're going to take care of liability.
Let me just be clear. We're in an emergency. We've had to attract healthcare personnel who haven't been in the industry, perhaps because they left to do something else with their lives. We want them to come back, and many of them have. We have people who are near graduation as nursing students. Maybe they were 2 months away. And we're going to be temporarily licensing some of those, as well as medical students. And so those are not normal ways. That's not a usual way to staff a facility, a medical facility. And so the existing liability laws don't really contemplate that. So we had to make some special arrangements so that in this crisis, I mean, as we're hitting peak and we've got so many people that we need to come back into the field or to enter the field, medics from, who may not have been licensed ever, but medics who had been in the military. And so we're bringing all these people in, and we want to make sure that they know, and the hospital personnel, the administrators, and everybody that are operating across the city in these very unusual and trying times, that they can use these personnel, and that they must use these personnel in order to deal with the onslaught of patients that are coming.
Governor, I'm sure you saw in New York the Navy ship that they had set up. Is there any lessons to be learned from that? I know it's different. I know they're not treating COVID-19 patients, but it seems like they haven't seen any patients. Is there a chance there will not be patients here?
Well, there's a big difference between the hospital ship that arrived in New York and this facility, other than we're not on water here, and we're in a better state than any other state in the United States. But the biggest difference is that their ship is being used for non-COVID patients. So that's an enormous difference. That's why you heard people say this is unique here. We're taking COVID patients here. These are people who are recovering or people who are lower acuity. who don't need to, who can leave the existing hospital that they were at and come somewhere else to convalesce or to go through their symptoms. And so that's very different. And now I don't know what's going to happen with that hospital ship and whether it'll fill up. I presume it would. I mean, I can't imagine with beds available and the number of people that are getting sick, there must be non-COVID patients that need somewhere to go. But I'm glad they have that availability to them. To be honest, when I heard that California and New York were going to get ships, hospital ships, I asked maybe it's not such a bright question, can we get one in the Great Lakes? Can we get one in Lake Michigan? And the answer is no. I mean, it would take too long to get a ship to Lake Michigan, and frankly, they didn't have one available for us. But you don't get if you don't ask.
I guess I just wanted to understand, like, is it possible that we might see not a lot of patients here and it's just preparing for the worst? Is that part of discussions?
From your lips to God's ears. That is honestly what we are praying for. If no patient ends up at McCormick Place, then we will have done our job. People will have stayed at home. They will have done what they needed to do to bend this curve and for people not to get sick. So I pray that that's an accurate assessment. Thank you.
Thank you. Yes. No, I plan to be on that call.
Okay, very good. Tomorrow afternoon?
Yes, right. Very good. Hey, man, how are you? I was wondering if you were going to be out here.
Yeah, we're on the way.
All right, good. Good to see you.
You doing well?
Yeah, you know what? Hang in there. Oh, you guys have done a tremendous amount, and I look forward to the call tomorrow.
All right. When all this is done, wrap it up.
Yeah, I'd love to. Love to.
Hey, great announcement yesterday.
Oh, yeah, I'm excited.
It's good for the city.
No, I think it's going to be really good for the city.
All right, very good. I'll just get going. Thanks.
Absolutely.
If you want to go with them on the tour, just follow the mayor, yeah. Jim will take you.
Pressure for more severely ill patients. So for this initial 500 beds, it's for lower acuity patients. We're expecting for all of them to be ambulatory and to be on the convalescent stage of their illness. They're all COVID positive, but they're starting to feel better. But they still need some medical care before they go home.
Governor, I don't know if you've met them directly, but this is part of the team from DuPage Medical.
You guys are doing amazing
phenomenal.
work, really. Phenomenal. So you all have there's a bay that the EMTs will be coming through, and it's some direction. That corner? Okay, got it.
Behind you is where the medical staff will be entering and exiting. And when they enter the room, they're in PPE from the beginning until the exit again.
And is there someone who will be, I've seen pictures or video of personnel in New York where they have somebody lacing everybody up and getting them all, or somebody else, you're not preparing yourself. In some cases, maybe it's doctors or nurses who are directly dealing with the patients. Is that the case here? Will there be they'll be sort of doing each other's?
Yes, I think we'll be monitoring each other.
Yeah.
Making sure that we're all following proper protocols. We'll have training starting next week with very clear processes for appropriate donning and doffing of the PPE. In that process is really the highest risk time for infection. So we need to follow those protocols very closely.
Very good. Okay.
So we've started the process of building the SOPs for the operation of the facility.
That's in D, is that right? Is that where the next the piece of this is? Sorry, negative pressure. I was asking about the negative pressure.
Yes, so it'd be in B, and that will be area with tents and
Just, I can't believe you're able to do that.
Hopefully, like
We're
you said,
surprised
we won't
too.
need it, but
Yeah, yes.
if we do, we'll be prepared. So this is an example of the rooms that we have set up. This is nobody's ideal for where they would convalesce, obviously, to be in a hall like this. But this is an emergency, and so we've done everything possible to make this as comfortable for them as possible. Every room has a cot, blankets, face masks for the patient, earplugs, and their own outlets so that they can charge their devices, have entertainment if they need it, communicate with their family.
And I know that the FMS, the field medical station, the 250 beds each, are all these items that I can see from that FMS kit, or are there some things that have been added, towels or something else?
Yeah, I think it's a combination of sources and kits that we set up. But this is unique, and so we're adjusting some of the supplies to be more appropriate for this situation. Like
So most importantly, the call light.
yes.
Yeah,
So,
right.
Thank you. There is a call light system, so anybody that has an urgent need, they pull the cord, this lights up, and the staff is alerted that there's a need, whether it's something simple or something more emergent. Part of the standard operating procedures that you were referring to, we're working also on some patients with COVID. We all know can become very ill quickly, even if they're sometimes in the convalescent stage. And so we're coming up with appropriate protocols to safely monitor for that happening and then transfer appropriately to a higher level of care again.
And will that, do you anticipate the B concourse lead where you might take them, or is it more anticipated that they're going to go right out the door and
I
back to
think
the hospital?
initially, definitely back to a hospital. That's really where the acutely ill patients need to be. The hall B is really the kind of worst case scenario when the hospitals don't have enough space.
Yeah.
Oh, you look.
So these will be organized.
Watch your back, guys. Watch your backs.
Very regimented manner, trying to maintain people's distance as much as possible at first, and then slowly as it fills up, bringing them closer together. And we will have extensive security in the facility as well to make sure that all of the patients are safe, and as well as the staff.
So each of the nursing stations, like that one there, how many do you anticipate in each nursing station?
So we want to talk about staffing a little bit because we're anticipating that we're going to start out with one staffing model and make sure that we're adequate.
It might evolve.
Go up if we need to.
Yeah.
But
So each station should have, I think at the beginning it would be 1 to 2 physicians and multiple nurses and additional MAs for vitals and medication administration and food service and all of that as well. So this will be strongly staffed. The patient will be left to.
And I was asking the other day about the use of, we're in an emergency, and, this is very highly unusual, as you pointed out. The restrooms are commonly, they'll be used in common, right? And so it's important that the acuity level of a COVID patient, I assume, on a given area, and, that using the restroom particularly is sort of similar to all the other patients. But you don't anticipate that, COVID patients using a similar area together if they had to.
There's right. They'll be, they all have COVID, so the concern for cross-contamination is not as high. So there will be definitely high standards of sanitation and protection, more frequent wiping down of all surfaces, but there will be a separate bathroom area for staff. So that's where the contamination might occur.
Hopefully we'll never have to.
Yeah. Very, very strongly agree. Are there any other questions?
No, I mean, just say again, thank you. This is phenomenal. As I said first night earlier, effectively almost done these major ways. Huge difference in seeing incredibly incredible relief to know that we've got great community.
I appreciate your forward thinking and your support for everything that's going on here.
We're really proud of what you're doing. I mean, I know you're giving a lot of yourselves to get this done, and honestly, it does the heart good to see so many people doing it with such verve. Hearing a lot about what's happening here and about the people who will come here. It's overwhelming for me anyway to see what's happening. So thank you.
Thank you for being here. Your presence means a lot to everyone who's working for us. Yes, I'm sure we will, and by the next time you're here, we'll have computers and nurses and doctors and everybody throughout this area.
Both Dave and Tom are Chicagoans.
Yeah, I know.
Originally, so when I came in here, I thought, okay, well, maybe we've got who knows where the leadership came from to do all that. Nope, you know it, right? Chicagoans, Illinois. You too.
Nice to be back.
That's why this is the best.
Thank you. All right, Governor, we're going to go this way.
Oh, we are? Okay. Mayor, good job. Thank you very much.
Oh, thank you.
And I'll take you upstairs. Am I missing anybody?